Good evening. Welcome to 90 Days University Professional Fee Final Mastery Program of Auricle. Today is first class of epidemiology, which is the crux of preventive and social medicine. Today we will be discussing about rapid revision of all important questions and volatile facts, quick revisions of IL topics, and most expected topics will be covered in this sessions. Today we'll be discussing the short essays of epidemiology, that is definition, concepts, and aims, and epidemiology explain its public role, and again a note on epidemiological triad and its applications, discuss the determinants of health and disease with examples, and explain the concept of natural history of disease and its importance. And in the last we'll be having descriptive and analytical epidemiology examples also. Why we choose Auricle? Auricle is a place where we get 5 modes of learning, that is recorded classes, live classes, practical sessions, exam modules, and hard copy book sets. In recorded classes, you'll be learning about uh, convenient revisions you will have, and you'll be getting foundational classes where you can prepare for all your professional exams and FMGE exams. It is a flexible learning, and expert instructors will be available for teaching all these things. Okay. And in live classes, you'll be having in-depth coverage of the topics, and experienced educators will be teaching you about this, and you'll have interactive sessions in live classes also. And in express exam modules, you'll be completing the whole syllabus in 20 hours. That is a comprehensive and efficient coverage where you can complete your whole syllabus a day in a less than a day for your complete exams, and it will be done by expert educators. One-to-one doubts clearing session will be there, which is student friendly and as well as a safe learning environment. And you'll be given a personalized attention to all the students so that you can go to your exams completely in confidence. And hard copy book sets, it gives you the in-depth coverage of last 10-year previous questions, and which are most anticipated or most commonly asked, and it will be taught to you by our experienced educators, and you'll be having Viva OCs also. And you'll be getting a 3-level question bank, that is from beginner to expert level, customized for your better exam preparedness, and it covers professional exams, NEET PG, and FMGE exams. And you'll be having practical sessions also, which gives you a hands-on experience, and you'll be having a complete confidence for your practical exams and Viva OC. For all this, you have 4 types of learning plan, that is foundation plan for 3 months, which is at 19,999, and whereas advanced learning plan for 6 months, which is at 32,999, and complete learning plan for 59,999 for 12 months, and a complete course plan of MBBS, that is for 1.9 lakhs. Do not worry about the fees, you will be getting a very good discount by using the discount codes below. Okay, with this we'll start with our first question, that is define epidemiology and explain its scope in public health. What is epidemiology? Epidemiology is a study of occurrence and distribution of health related states and events and processes in specified populations, including the study of determinants which affect these events such and processes, and applying this knowledge to control relevant health problems. You study the occurrence and distribution of health related events, states, and processes in a specific population, including the determinants which affect those processes, and apply that knowledge to control the relevant health problem. This is the definition. What is the scope of epidemiology in public health? 1. To study the historically the rise and fall of disease in the population. Historical perspective studies the rise and fall of diseases over time. There was a rise in COVID and there was a fall in COVID. Okay. The more you look back, the more forward you can see. That is the actual statement which has been made by Winston Churchill. Okay. It what else you study? The dynamic disease pattern. Like coronary heart disease was once an epidemic, later the conditions of cancer and diabetes were also studied similarly, and they are also be treated as modern epidemics today. And diseases patterns change over time. Emergence of new diseases, like old diseases were eradicated, while the new ones, AIDS, Lassa, fever, Ebola virus, and Zika, all these came into picture. Epidemiology identifies and studies these challenges in the nature. Trend analysis. In respect to what? In respect to person, place, and time. And identifying the emerging problem. Today's emerging problem is problem is obesity. Okay. And future planning, which helps the whatever you study in backwards also helps you to plan for your future based on the previous trends. Next, we have community diagnosis. What does community diagnosis means? It involves identifying and quantifying the health problems in a community using rates and ratios, morbidity rates and mortality rates, like crude birth rate, crude death rate, early infant rate, infant mortality rate, maternal mortality rate, child death rate, or prenatal mortality rate. All these things are measured under epidemiology. What is the purpose? To set priorities, that is quantification of health problems. You can't say that maternal mortality is too high without doing any without measuring the number of mortalities. Okay, that quantification of health problems aids in prioritizing the disease control and prevention. Okay, evaluating health services. You have launched a service, a government has launched a service, whether that health service has been doing its to the mark, up to the mark, or it's just there in the field, or it is not able to reach the target population. That can be evaluated during community diagnosis. And it provides these insights to this distribution of disease, causation, and prevention. And in extended scope, it goes beyond life illness, that is social, cultural, and environmental aspects of also of the community. What is the role of epidemiology in this? It acts as a diagnostic tool of community medicine. You will be able to assess the uh, program, or you can assess the intervention or teaching whether it is reaching the target population or the beneficial population. Hence, it is called as a diagnostic tool. What else it helps in? It helps in planning and evaluation. Planning of what? Rational resource allocation. All resources cannot be built in the metro cities. There is requirement of distribution of hospitals in rural areas also. So this helps, epidemiology helps in distribution of resource, and it forms the basis for planning. Like when you take a literacy rate data, where you want to put more of funds regarding to literacy, you want to put it in Kerala where there is more than 98% of literacy. No, you want to put it in a state where there is less literacy. Similarly, in healthcare, you will put the more fund allocation or more manpower reallocation to the states where there are health problems rather than where the health facilities are available. Okay, like planning for immunization campaigns, sanitary services, prioritizing research topics on health data. And in evaluation, it affects the assessing the effectiveness, if control or preventive measure, whether the vaccination program is running well or it is reaching the as per the expected coverage area, that can be assessed through the effectiveness. Cost effectiveness by considering the cost benefit ratios and associated risks. Assessing costs of vaccination program, which includes storage, personnel, and transport also. Role of randomized control trials, like challenging the utility of multiphasic screening, like tonsillectomy, varicose vein stripping, and hospitalization. These are the hospital studies which can be evaluated using epidemiological methods. Evaluation of individuals' risks and chances. What is the role of epidemiologists in this? Assessing and quantifying the risk, the degree of risk within the population. Okay. And it measures absolute risk and relative risk and attributable risk. three risks are measured in epidemiology, that is absolute, relative, and attributable. Absolute means it measures like incidence and specific rates that represents the overall probability of the disease. Relative risk, it compares the risk. Absolute measures, relative compares, attribute estimates. Three different words are three different meanings. Absolute risk measures the incidence, whereas relative risk compares the risk between exposed and unexposed groups. There is a comparison always in the relative risk. And in attributable risk, estimates the proportion that of out of 100, 10 are developing the disease. That is the proportion which is attributable, called as attributable risk. Okay. Applications of risk valuation, again, in genetic risks, the likelihood of bearing child with Down syndrome. Lifestyle risk, evaluate the risk of based on behaviors, that is smokers and non-smokers developing cancer and coronary artery disease. Practical examples are calculating the risk for specific deaths on exposures, like you can say exposure to radiation, exposure to biomedical waste, all these things, and use of epidemiological data to counsel individuals or populations about preventive measures. These are the practical exams the where the individuals and risk and chances are involved. Coming to the next role, that is syndrome identification. Okay, what is syndrome identification? Syndrome is not a what we say, it is not just signs. You have multiple signs and symptoms coming together, and it is multifactorial in nature. All the symptoms have to be present when you have to say it is a syndrome. Syndrome is a group of, you can say it is a group of disorders or a group of symptoms. Okay, it is identified through observation of recurring patterns of symptoms and signs in individual patients. Okay, what is epidemiological role? It helps in defining and clarifying syndromes by analyzing patterns. This does not happen in hospital settings, it can happen only in epidemiological settings. Okay, and it reduces the misconceptions. What we say, for examples, in syndrome refinement, initially peptic ulcer before 1920, there was no understanding between gastric or duodenal ulcers. Peptic ulcer is just one ulcer. Okay, there was a difference between gastric ulcer and the duodenal ulcer because of the epidemiological study. Okay, epidemiologists, they revealed that poverty gradient for gastric ulcers, but not for duodenal ulcers. There was a huge differentiation that poverty played a role. And in Patterson-Kelly syndrome, it was initially thought to associate with dysphagia and iron deficiency anemia, but this was disproven. Okay, because anemia was a global problem. It not only existed in Patterson-Kelly, but it existed in other people also where there was no dysphagia. Okay, the population study revealed that this mismatch of iron deficiency and anemia with Patterson syndrome, Patterson-Kelly syndrome. There's another name also for this. It is called as some Vincent syndrome. Okay, it provides insight to hypertension syndromes, causes, prognosis, and treatment, and it helps in identifying and defining the syndromes, contributing more accurate to the diagnosis and treatment procedures. And epidemiology helps in completing the natural disease history. Okay, how? It contributes in identifying the risk factors, and initially epidemiology revealed that one third of two-thirds due to ischemic heart disease are sudden nature. Okay, what it uh, this resulted in development of ICUs. Okay, and epidemiological research has identified number of risk factors for chronic diseases, and not just the acute ones. Okay, and it also helps in identifying the pattern in the community, how the disease is differing in the pattern in the community settings, and they can come to a you can come to a ground, or you can come to a concrete solution. What is the agent, what is the host, and how the environment is playing a role in this. This is called completing the natural history of disease. Searching for causes and risk factors. This is the actual or the main aim of epidemiology. It identifies on a larger population that what could be the risk factor for the defects or the diseases and all. In congenital defects, rubella was established as a congenital risk factors for congenital defects in newborn. Otherwise, congenital people thought congenital defects could be because of genetic mutations and everything. But on larger scale, when it was studied, it was identified that rubella played a role in congenital defects. Teratogenicates identified like thalamide also caused thalidomide also caused birth defects. Lung cancer linked to smoking. Retrolental fibroplasia again found oxygen exposure in premature babies is one of the cause for retrolental fibroplasia. Again, what were the challenges we faced during the chronic diseases? We can't identify the single risk factor. It is very difficult to localize to some individual factor that is which is causing a chronic disease. Okay, the concept of risk factors, it's still under research, that every day there are risk factors which are going to change every minute. That is why the risk factors is always searched for, and ongoing efforts are there for causation factors and risk factors, which is a continuous process. And emergence of new diseases also causes is also a major role in epidemiology. With this, we'll go to the second question, that is write a note on epidemiological triad and its application. What is epidemiological triad? It is a model used in epidemiology to understand. It is a triad. Okay, we'll see the triad in later. This is small. This is as simple as triad with agent, host, and environment. Okay. In occurrence and spread of disease. Components are three, that is agent. Agent could be bacteria, virus, chemical, physical trauma, nutritional trauma, or accident, anything. Host, the individual or the organism susceptible to that disease, influenced by intrinsic factors like genetic immunity, age, sex, gender, behavior, etc. The third factor is environment. This environmental factors exposure, like environment includes physical conditions, biological conditions, socioeconomic conditions, etc. And in the middle we have time, agent, host, environment, and in process of time. In vector-borne disease, you can have vectors also, but in the agent, host, environment, it comes, you can't fit in any there. Okay. Next, we have disease applications of epidemiological triad. That is by addressing any component of triad. Okay, the disease transmission can be interrupted. You have agent, host, and environment. All three have to interact together for a disease to occur. Okay, like in malaria, agent is parasite. Sorry, agent is parasite, human, and environment is the breeding site. You take out the breeding site, again the malaria transmission discontinues. You take out the host, again malaria transmission discontinues. You take out the parasite by giving medications, again the transmission is broken. Okay, and it helps in identifying the risk factors where you can intervene. We'll see the extended advanced model of epidemiological triad where the other risk factors is also seen. It helps in forming the public health interventions by vaccination programs, improving living conditions, that socioeconomic status, environment part, and using antimicrobial drugs to control the agent. Okay, and vaccination for the host. And it helps in outbreak investigations and understanding the chronic diseases. Okay, example we have already seen: agent, host, and environment. These are the three parameters in malaria. The limitation is that triad is very simplistic and may not account for multifactorial causes of some new emerging chronic, or we say urban epidemics. So applying the existing model is difficult. So therein came by the advanced model of epidemiological triad. Okay, this involved causative factors, group or population and their characteristics, and environment. Causative factors is similar to agent. This is similar to host, and again in presence of time. Causative factors is replaced by traditional term, that is agent. Includes diverse ideological elements such as biological, chemical, physical, social, behavioral, whatever causative factors can be added. And it recognizes the disease often have multiple causes instead of single pathogen or agent. Groups and populations, again, it depends on age, gender, socioeconomic status, cultural habits, race, place of stay, all these things. Environment, behavioral, cultural, ecological, and physiological factors, social determinants of health, including living conditions, education, and access to healthcare. Okay, in between, we have time, duration of exposure to that patient, that agent, incubation period to cause the disease, and time trends in disease occurrence. In Viva OC, you can be asked what is incubation period, what is window period. All these things can be asked in the Viva. Applications of advanced epidemiological model, you can apply them to the modern epidemics like diabetes, coronary heart disease, and tuberculosis, where poverty, malnutrition, overcrowding plays an important role, and multiple interventions can be planned, like reducing causative factors, vaccination, smoking, etc., modifying population characteristic, improving their health and education, and addressing the environmental contributions like good water, better housing, and clean environment. And clinical chronic disease management, it provides a comprehensive framework for understanding the multifaceted nature of diseases. Okay, by what? By integrating the causative factors, population dynamics, and environmental influences. In chronic illnesses like interplay of lifestyle factors, genetic predisposition, and environmental triggers. And in global health challenges applicable to new diseases, useful for designing public health strategies at national and international level. And it also helps in research by understanding the disease progression and causality through what statistical methods and longitudinal studies, that is the forward studies. Okay, with this we have finished two questions. We'll be going to the third one, that is discuss the determinants of health and disease with examples. Okay, health is a factor which has been influenced by both within self and the external factors. Okay, the internal factors are genetic factors. Okay, these are the traits and characteristics how a person inherits from their parents. Environmental factors such as community or the air they breathe and the water they drink. Health is the interaction of both. Hmm? This is the picture from the park which says that which are the determinants of health. If you are, if you can be able to remember all these determinants, it well and fine. And please do remember, if it is a 10 marker, you will be writing all the determinants. Okay, we'll go one by one. Biological determinants, uh, like genetic influence on the health. If there are any genetic, what we say, like fibrosis, cystic fibrosis, or sickle cell anemia, they are genetically inherited, affecting the individuals from the birth. There might be carriers, there might be the affected ones also. Okay, how do we prevent this? By genetic screening, prenatal genetic screening, like amniocentesis or genetic counseling, can help in identifying those diseases in an early stage and preventing them or providing treatment options. What are the treatment options you can provide? Those are gene therapy. Okay, this is the gist of the whole slide. Okay, you can remember how much ever points you want. Biological determinants are nothing but the conditions already pre-exist because of the genetic trait of the individual. Okay, how can we identify? By genetic screening, prenatal screening, and how can it can be treated? By gene therapy. Next, we have behavioral and sociocultural conditions. In behavioral conditions, lifestyle concept is more important. Like once, whatever the lifestyle habits you have, and what are the uh, choices you make in the lifestyle. Like you will have consumption of alcohol, smoking, having deep fried foods, diet, unhealthy diet, or personal habits, what we say, sleeping late in the nights, less reduced physical activity. All these are behavioral practices. You have cultural practices also which are there in your life, which can affect the disease outcome. Okay, not all lifestyles are harmful. That is one there. Healthy habits such as adequate nutrition, sufficient sleep, and regular physical activity also promote good health. It is also a determinant of good health. Okay, next we have environment. In environment we have exposure to what we say, internal environment, you can say body components, exposure to chemicals, or external environment, you can say the environment which you live in. Okay, the physical environment where exposure to chemicals, pollution are causing more diseases of asthma and COPD. And biological environment, which is the biological organisms which are living around you, those are mosquitoes, houseflies, cockroaches, all these things, ticks, which help or aid in spreading the disease. And we have psychosocial environment, in which you can assess the level of stress the individual is undergoing. And we have occupational environment also, where the individuals are exposed to specific chemicals or specific agents like lead or sawdust or bagasosis, bicyanosis, sugarcane dust, all these things. And other microenvironment like where you live. It could be very poor or overcrowded areas, slums, where there is poor hygiene and sanitation. This is the gist of this whole slide. Write as much points you can remember. You can write physical environment, biological environment, psychosocial environment, occupational environment, and micro. Like in physical environment, housing, biological includes this, psychosocial includes stress, family structure, etc. They're interconnected basically, and they have impact on a favorable environment for the individual. Next, we have socioeconomic conditions, low per capita income, economic progress in the developing countries reduces morbidity and improves quality life. Yes, higher socioeconomic groups may experience higher rates of disease like uh, diabetes, hypertension, etc., compared to the people who are in lower socioeconomic status. Okay, education, again, higher levels of education plays an especially in a gender among women correlate with their lower rates of child mortality and better overall family health. Like what we say, if the woman is educated, it is a family which gets educated. It is as simple as it. Occupation, it promotes health, and as an unemployment is often linked with higher rates of infection or death or illness. Political system, but the political system which is better committed in providing good health care to the public, the country has less admission rates or the what we say better outcomes in the health policies. Okay, like in Scandinavian countries, that is good. Socioeconomic conditions again, it it improves economic development, education, nutrition, employment, and housing systems. Whereas in role of leadership, political leadership, if they are committed to give the good amount of GDP towards the healthcare, it can give a good results in return. Health services, availability of health services is the one of the most important thing, and provision of preventive health services and provision of immunization, safe water, and maternal health. They have their own effects on outcomes of the health. Immunization reduces again incidence and prevalence of specific diseases among children in the specific age group. Safe water provision prevents morbidity and mortality from waterborne diseases from all age groups. Okay. Maternal and child healthcare reduces in the specific gender and the age group. These services can be evaluated whether they are equally distributed or not, socially acceptable, and reach even most peripheral sections of the society. Primary healthcare is one of the holistic thing which can be the determinant in the health services, and there is a strong correlation between economic development and health. If the country is doing well economically, the provision of funds towards the healthcare sector is also good. Okay, and but there's no correlation between medical density and life expectancy. This is one thing which has to be considered. Key goal of health services is to improve health, and the primary criteria for evaluating the effectiveness of the program. Next, we have aging population. By 2020, the old world had more than 1.4 billion unaged. Over one two-thirds are living in developing countries. Okay, it is true that we have more old age people than engaged people. Health of the elderly. Many elderly people now enjoy better health than before because the rapid population aging present there are too many challenges in the younger population. Okay, focus on women health. Agenda of women health, that is nutrition, reproduction, health of and consequences of violence, aging, lifestyle conditions, and occupational. This is all generic. You can write on your own, whatever you feel like. Other factors, transition to the information age. Okay. The more information is actually more problems, leads to more problem. Okay. Has revolutionized, yes, the technology has revolutionized all the information, and it has made availability of medical information easier to all people. However, it has also posed a difficulty that uh, what we say more confusion in the people while they are becoming Google doctors. Health related systems and outside healthcare. Several systems in India are formal in nature, whereas there are certain healthcare systems which are run by private. So this has to be integrated. Next, making policies in welfare of people and intersectoral coordination. That is like in coordination of education, public works department, agriculture, social welfare departments in healthcare sector also helps in also plays an important role in making the health as a priority. Okay. The next question we have the concept of natural history of disease and its importance in preventive medicine. The concept of natural disease is just one table which gives you the complete history of natural history of disease. If you are able to remember this table, your clean 5 markers completed. You can write as much as points you can remember in this table. That is from pre-pathogenesis stage to stage of pathogenesis. Okay, let's see. The natural history of disease, what does it refer? To the progression of disease in an individual from its initial exposure to the causative factors to its potential resolution or chronic state or death if no medical intervention occurs. That means the individual is exposed somewhere here and he will go through all the phases of disease. If there is an intervention, there might be a recovery or a partial recovery, or there might not be recovery. And if there is no intervention, there might be recovery or there might not be recovery. Okay. What happens in pre-pathogenesis phase? This phase occurs before the individual becomes affected by the disease. There's an interaction between the agent, host, and environment. The triad, there's an interaction here. Okay, for example, again I've took the malaria example because it is easy to remember. Overloading with information is very does not lead to anywhere. Okay, that is why malaria is used anywhere, everywhere. The agent, host, that is person, and the environment, that includes stagnant water where mosquitoes breed. Okay, elimination of mosquito breeding grounds and use of insecticide treatments is the primary prevention. Stages of natural history of disease. That is, first is period of pathogenesis. Disease begins in the host and progresses through the following stages. Okay, we have just finished one pre-pathogenesis. Okay. In early pathogenesis, the disease process starts, but no symptoms are seen. Okay. Example, Mycobacterium tuberculosis. It infects the lungs, but patient is asymptomatic during the latent phase. He's just it doesn't have any symptoms, so it looks very normal. Clinical horizon is the disease becomes detectable through signs and symptoms or diagnostic tests. For this, the patient should have persistent cough or fever or weight loss or any other symptoms. Advanced disease is a phase where the disease progresses further and more complications have occurred. That is fibrosis of lung in case of TB, chronic conditions like uh, pot spine, or they can be death because of complications also. What are the levels of prevention in this? Primary prevention happens during the pre-pathogenesis phase. Okay, there's a intervention or there's a cutoff between interaction of agent, host, environment. Okay, there are two types of strategies, that is health promotion and specific protection. Health promotion, you do it on a large scale by uh, advertisements, by telling them you do good diet, there is no obesity and there is no hypertension or diabetes. Do regular exercise, you might not develop so and so. Anti-smoking campaigns to reduce smoking so that tuberculosis, carcinoma of lung is reduced. Specific protection against the diseases or disorders. What is the specific protection? Measures like vaccination, fluoridation of water, and use of helmets in case of accidents. That is specific protection to the outcome. Again, examples: immunization against measles prevents the disease from occurring. Use of clean water supply prevents cholera. Secondary prevention used during early pathogenesis and clinical phase. Okay, the objective is to detect and treat diseases early or halt or slow their progression. What is the strategies? Early diagnosis and prompt treatment. Early diagnosis is done by what? Screening programs for the diseases like breast cancer, diabetes, hypertension, prostate cancers. All these are done by screening programs. Prompt treatment by giving right medications at right time to treat infections and to prevent complications and to maintain the healthy life. Example again, pap smear, routine blood tests for hyperlipidemia, hypercholesterolemia, and diabetes mellitus. There is tertiary prevention, which happens during the advanced disease phase. Objective is to reduce the complication, minimize the complication to reduce the disability and death, while promoting recovery or adaptation. Strategies are disability limitation and rehabilitation. For example, individual has developed uncontrolled diabetes mellitus. So you help him or her in reducing the blood sugar so that the complication will get prevented. Like example, neuropathy, nephropathy, and retinopathy. Okay. And rehabilitation, assisting individuals by in achieving optimal functioning. The individual has developed diabetes and there is a diabetic gangrene in the right foot, and because of this has got a amputation. Now he has right leg amputation, so he has to be rehabilitated. In disability limitation, you reduce the blood sugar so that there is no other complication. In rehabilitation, you provide the accessories or prosthesis so that they can function on their own. That is rehabilitation. This is the examples across the stages. If there is in pre-pathology stage, elimination of stagnant water to prevent malaria. Screening for hypertension is secondary prevention before complications. Diagnosing and treating tuberculosis, again secondary prevention. Providing insulin to prevent diabetes related blindness, it is a tertiary prevention. Providing physiotherapy after a stroke is tertiary prevention, that is rehabilitation. What is the importance? It helps in making public health strategies and it allows the efficient resource allocation. You can't screen for all the female for breast cancer, so there is a age cutoff. It improves the outcome and promotes health equity also. Today's last question is differentiate between descriptive and analytical epidemiology with examples. This is important because most of the MCQs also comes with this question. Descriptive epidemiology is one of the two main areas of epidemiology study, that is analytical and descriptive epidemiology. What is it responsible for? It is responsible for determination of patterns of disease. How do they occur? In respect to what? Person, place, and time, and what are the clinical symptoms or information we get. To assess this, we call it as describing a disease in respect to person, place, and time. That is who, when, and where. Okay. This is called as descriptive epidemiology. What is analytical epidemiology? It is a complex and broader area than descriptive. Accepted. It is responsible for testing the hypothesis built in descriptive epidemiology. Descriptive epidemiology tells you when, where, and why, how, sorry, when, who, how, and where. This is validated by analytical epidemiology. Therefore, the main objective of analytical epidemiology is to assess the determinants of diseases, risk factors, and causes, and to validate them. And it analyzes the distribution of disease and their exposure. These are the differences. The purpose of descriptive is describe the distribution. The word describe is descriptive, and the word investigate the cause and risk factors of diseases analytically. What are the questions answered are who, where, and when. It is similar to your www.com. Okay. Whereas epidemiological question, analytical epidemiology asks questions: how did it happen and why did it happen? Why did this disease happen? These are the questions, and how this disease came into picture. These questions are answered by analytical epidemiology. Examples for descriptive is case reports and case series. You might be seeing in the journal, the last pages will be case reports. It is a documentation of characteristics of patients with a particular disease. And cross-sectional studies measures the prevalence at particular point of time. And incidence studies track new cases over a specific period. Okay. Whereas in analytical epidemiology, we have case control study, which is comparing the individuals with and without a disease to identify the risk factors. You have a comparison group. Cohort study is again a group followed over time whether the disease is developed or not. Okay, and RCT, randomized control trial, is for testing the effectiveness of the treatments. This is one of the examples of RCTs. For in descriptive epidemiology, the data is available or you can collect the data over time. Like record surveys and registries, the data is available. Whereas analytical epidemiology, it is collected over a period of time through observational or experimental studies. Okay. Study design is simpler and less resource, more complex and resource intensive. Hypothesis generated in descriptive, it is tested in analytical to establish a relationship. The outcome provides information for public health and planning and resource allocation. It provides the evidence for developing the prevention and intervention strategies. Analysis, what we can get is rates and proportions. In this, we can get relative risks and odds ratios. Inference, you can give the inference of particular study. Scope, it is on smaller scale, it is on larger scale. Types of studies again we have seen case reports, case series, cross-sectional and incidents. Here it is case control, cohort, randomized control trial, and ecological studies. Examples: case control study documenting 100 cases of SARS, their age, gender, and location. And in cross-sectional, conducting a survey to determine the prevalence of diabetes in a city at specific point of time. Incident studies, the COVID one, over 6 months to years. Okay. In case control studies, we can compare the individuals with lung cancer with or without this factor of smoking, like old age example, that is the individual who are developing cancer are likely to have done smoking. That is the outcome of that study. Cohort study following a group exposed to air pollution and a group not exposed to track the respiratory diseases. And again, RCT for testing the vaccine efficacy and efficiency. Okay, with this, we have completed our class. We have MCQs for today. Which of the following best defines epidemiology? A study of disease patterns in individuals, study of distribution and determinants of health related states in specified population, study of medical treatments and their effects on individuals, study of lab findings related to diseases. The right answer would be B, because epidemiology is the study of how health related states or events are distributed in a specified populations. Okay. The epidemiological triad consists of which of the following components? Agent, host, and environment. It is very easy to say. Okay. A is the answer here. The natural history of disease focuses on what? The time it takes for a patient to recover from treatment, the progression of disease without medical intervention, the impact of healthcare system on disease management, and role of prevention strategies on diseases. Actually, the answer is B, because it here the natural history studies the both pre-clinical phase, clinical phase, and the outcome phase. Okay, that is the complete natural history of disease. Which of the following is a key difference between descriptive and analytical? Descriptive epidemiology tests hypotheses and analytical epidemiology generates them. It is actually to be other way around. Descriptive epidemiology generates hypotheses and analytical epidemiology tests them. Yes, it is correct. We will not stop it here. Descriptive epidemiology focuses on treatment and analytical epidemiology focuses on prevention. Wrong. Descriptive epidemiological studies individuals and analytical epidemiology studies populations. No, both of them study population. The primary aim of epidemiology is to treat disease effectively. No. The identifying risk factors for diseases. Yes. Prove definitive cures for chronic diseases? No. And ensure universal healthcare? It is not the responsibility of epidemiology. Which of the following is not a determinant of health? Not. Very dangerous word. Genetic predisposition? Yes, it is a determinant. Socioeconomic status? Yes, it is a determinant. Historical population trends? No. Physical environment? Yes, it is a determinant. An example of modifiable determinant of health is there are non-modifiable and modifiable. Age you cannot modify, gender you cannot modify, smoking as you can modify, genetic predisposition you cannot modify. That is why smoking is the right answer. The term epidemic refers to a disease restricted to a specific group. No. The normal occurrence of a disease within the population. No. An unusual increase in number of cases of disease. Yes. Okay, because epidemic refers to the occurrence of disease cases in a population or a region or community that exceeds what is normally expected from that area during the specific time period. It is a global spread of disease? No. Which of the following is not included? Again, not. Control of health problems? Yes, it is included. Study of disease distribution? Again, included. Determination of treatment effectiveness? It is not a part of epidemiology. Yes, it is a part of epidemiology. This is the right answer. Study of the political decisions is nowhere related to epidemiology. So D is the answer. Which of the following diseases best illustrates the epidemiological triad? Diabetes, malaria, hypertension, and osteoarthritis. And this the answer would be malaria because the other three factors have multifactorial causation. Okay. Here the triad is agent is humans. Sorry, agent is plasmodium. Host are humans and environment is where the mosquitoes are breeding. Okay. In contrast, diseases like hypertension, diabetes, and osteoarthritis, they are multifactorial in nature and they are chronic in nature. So applying epidemiological triad is very difficult in this. You can certainly apply the advanced model of epidemiological triad, but not the simplistic one. Thanks for watching. This is our last question. Thanks for watching Oracle. We have social media handles on YouTube, Instagram, Facebook, and Telegram. And we have app on Google Play for Android users and on iOS for Apple Store on Apple Store for iOS users. Please do this subscribe. Thanks for watching.
Thank you, sir.